The human foot is an engineering marvel of 26 bones and 33 joints. Considering that the average person takes 10,000 steps a day, which adds up to 150,000 miles over a lifetime, and each step applies 2 to 4 times one's body weight to each of these bones and joints, the foot has to be something of a structural masterpiece. There are 7 unique tarsal bones in the rear and midfoot regions. They are the calcaneus, the talus, the navicular, the 3 cuneiform bones, known as the medial, intermediate, and lateral cuneiform respectively, and the cuboid bone. In orthopedic terminology, the bones of the foot are generally referred to as components of 3 distinct regions. They are either part of the rear foot, the midfoot, or the forefoot, and specific surgical privileges must be earned for each area. The calcaneus and the talus are the bones of the rear foot, as differentiated from the 5 bones of the midfoot and the 19 bones of the forefoot. The calcaneus, or the heel bone, is the largest of the foot bones. Its primary purpose is to serve as a connection between the leg and the foot, and to provide leg and foot muscle attachments. It bears the weight of the body when we are standing upright, supporting the leg and allowing us to walk easily. The posterior half of the bone is called the tuber calcanei, and laterally on either side are processes for attachment of the tendons and muscles that extend to the metatarsal bones of the forefoot. On the very posterior aspect of the calcaneus is a broad, roughened area where the calcaneal or Achilles tendon, the largest, strongest tendon in the body, inserts. Anteriorly, the calcaneus articulates with the cuboid on the lateral aspect of the foot at the calcaneal cuboid joint. On the superior surface of the calcaneus, there are 3 facets, an anterior, middle, and posterior facet, where the calcaneus articulates with the talus in 3 distinct areas. The talus is a small, hump-shaped bone that sits at the top of the foot bones between the bones of the lower leg and the calcaneus. It is unique in that it is the only foot bone that articulates with the leg bones. The superior edge of the talus has 2 flattened areas on either side for articulation with the tibia and fibula. The tibia and fibula sort of ride on top and around the sides of the talus to form the ankle joint. Where the talus meets the bones of the foot posteriorly at the calcaneus, it forms the subtalar joint. This joint is particularly important as a shock absorber and stabilizer for walking over uneven ground. It also functions in inversion and eversion of the foot, allowing the calcaneus to pivot from side to side and to convert rear foot motion toward the forefoot. Where the talus meets the bones of the foot anteriorly, it articulates with the navicular bone at this large concave articular surface for which the bone gets its name. This large depression on such a small bone causes it to resemble a tiny boat, and the Latin word for little ship is navicula. Although technically part of the proximal row of tarsals, the navicular is considered one of the 5 midfoot bones because of its location. Distally, it articulates with the 3 cuneiform bones on its anterior aspect. Laterally, the navicular has an atypical articulation with the cuboid via a small facet called the occasional facet. This is not a true joint. The navicular actually just glides past the cuboid. The 3 cuneiform bones are located in the top middle portion of the foot and connect the inner metatarsals 1, 2, and 3 to the navicular. Together, they are particularly important in the arch formation of the foot. These bones are named for their resemblance to the wedge shapes used in cuneiform writing. The first, or medial cuneiform, connects to the first metatarsal. The second, or intermediate cuneiform, connects to the second metatarsal, and the third, or lateral cuneiform, connects to the third metatarsal. A large number of very strong ligaments anchor each of these bones in place and connect them, with all of the surrounding bones. The area of conjunction between the cuneiform bones and their respective metatarsals is known as Lisfranc's joint. Injuries to this area were first recognized and documented by Napoleon's doctor Jacques Lisfranc, who noticed that they often occurred when a rider fell from his horse while his foot remained caught in the stirrups. The cuboid, as its name implies, is the cube-shaped bone on the lateral aspect of the midfoot. The cuboid functions with the calcaneus to join the foot and the ankle and provides essential support and stability of the foot with weight bearing. On the medial aspect is a smooth facet for articulation with the third cuneiform, and just behind and inferior, the small occasional facet where it actually glides against the navicular. Posteriorly, the cuboid articulates with the calcaneus, and anteriorly, it articulates with both the fourth and fifth metatarsals at side-by-side articular facets, essentially forming the midsection of the entire lateral axis of the foot.